The number of cases of sexually transmitted diseases reached an all-time high in California last year. Public health officials are especially concerned about a rise in congenital syphilis. To tell us more, I spoke with Janeen Bulison, Vice President of Clinical Services and Quality with Planned Parenthood of the Pacific Southwest. Janeen, how do you account for this unprecedented rise in sexually transmitted diseases?
I think there are both systems issues and individual issues that are contributing to this rise. I think at a systems issue, public health funding for testing and treatment is not as high as it could be. And so I think that that's contributing to people not getting tested and treated as they should. And then at an individual level, I think that there's been a decrease in the fear of HIV that's contributing to people not using preventive measures such as condom use as frequently as they should.
Let's take each one of those one by one. Public health funding, we have an epidemic of STDs, so why aren't they stepping up with more money?
I think in general, in terms of the healthcare that we provide in the United States, there's always been a focus on treatment and not as much on prevention. And whenever you're talking about public health funding, it's primarily focused on prevention. And so I think that that's where we're not getting the funding that we need.
Safe sex messaging that's been out there for years, is it now falling on deaf ears?
I don't think that it's falling on deaf ears, but I think that seeing sickness is not as common as it was in the 80s and 90s, and so people don't feel like they can be affected, and so they're less likely to acknowledge the warnings and hear the messages.
Congenital syphilis has made a comeback. What do you make of that?
I think that also has to do with access to healthcare. I think in terms of lower income and immigrant families where the congenital syphilis has been identified, I think it has to do with patients accessing prenatal care early and receiving testing and treatment early in pregnancy, and then also ensuring that they do not get reinfected during the pregnancy.
What about oral sex? What's the role of oral sex in transmitting STDs?
Well, I think in terms of public health messaging, we frequently focus on penile vaginal sex. And so I think in terms of our role as healthcare providers, it's to talk about oral sex and rectal sex and talking about appropriate screening for STIs in all three areas that you could potentially be having sexual intercourse.
There was a movement to make HIV testing a routine part of medical care. What about making testing for all STDs a routine part of medical care?
I think it's based on risk factors and what we know within the population. So in terms of CDC recommendations, there is a recommendation for women under the age of 25 to receive chlamydia screening on an annual basis. And then also for men who have sex with men, there's a recommendation to have syphilis screening on a regular basis, but other STIs do not have as much of a focus there.
Why are we still having to deal with these diseases in this day and age?
You know, I think that sexual and reproductive health are just such taboo conversations in terms of the healthcare world. You would think that we would have adopted a comfort level with it, but I think if you work outside of places like Planned Parenthood, where you have these conversations regularly, that it's really hard to know how to broach the conversation and really make people feel comfortable to have an open and honest conversation about sex.
Lastly, if you were in charge of the public health system, what kind of steps would you take to try to get a handle on this epidemic?
As always, education is key. People, even if the messages are not being heard as loudly and clearly as they have in the past, that we do still need to provide that education and ensure that people understand what their risk factors are. And then I also think that we have to ensure as healthcare providers that we are really screening people for their risk factors and that we are testing them as often as they need to be tested and then getting them treatment as soon as we can after a positive test has been identified.